And thank you for, oh, sorry, Barbara, I didn't give you the heads up. So yeah, welcome everyone, and thank you for coming to this webinar where we will be having a discussion on how to transfer our SBC skills to domestic work. So today we know that the landscape has changed this year. We're just having a conversation with Linda and Anton that there many changes happened this year, but we believe and we are sure that our social and behavioral change skills are still needed domestically, internationally, etc. So today we wanted to come together informally with people whose SBC related careers have spanned to domestic work and global health to reflect, to discuss, and get insights for new ways to apply our skills. So today we have three wonderful professionals. We have Linda Bartfield. She's the Chief Creative Officer for Creative Conscience and the Vice President for the Social Marketing Association of North America. She's an award-winning creative professional skilled at designing social and behavior change interventions, whose career has spanned global and also local social marketing. We also have Jennifer Messenger. She is the Senior Executive Vice President of the Metropolitan Group. She's a social change. It's a social change agency that crafts and integrates strategic and creative services. She has more than 20 years of work in social change on all types of public health issues, from tobacco to reproductive well-being and other issues. So before joining the Metropolitan Group, she was the director of Prospect Associates, a contractor for the CDC. Then we have Anton Schneider. He's a lecturer at the School of Public Health at the University of Maryland. Until January of this year, he served as a senior social and behavior change advisor in the Global Health Bureau of USAID. He started his career in commercial market research in the US, specializing in communication research and consumer behavior. So how we are going to do today's, it's going to be a conversation. We're going to have a conversation with Linda, Anton, and Jennifer. And Lisa is going to guide us through some questions that we're going to use it as prompt to start the conversation. And as the conversation goes, we encourage you to just share your questions in the uh, in the um, in the chat box. Yeah, so thank you so much, and over to you, Lisa.
Yeah, thanks, Joel. And yeah, again, just sharing appreciation for Linda and Jennifer and Anton for being willing to reflect on their um, inspiring careers and help us get inspired today, too. So we're going to pose some questions. But as Joel said, we'd love for you to put any additional questions you have for these experts in the chat, or raise your hand and you can come off mute and ask directly. And we'll have time for plenty of discussion after the panel too. So we'd love to hear from you during this or as we go. All right, so the first question is about SBC skills that are relevant outside of global health and development for social change, for example, in the US. And I'd like to start with Linda. Linda, I know you have experience in an academic setting teaching social marketing. So when you're educating a new practitioner coming into the field, perhaps intending to work in the US, what knowledge and skills do you want to ensure the student leaves the program with?
Thank you, Lisa, and welcome to everybody. It's really an honor. And I'd just like to add that my colleagues Anton and Jennifer are calling in from the West Coast, so thank you for doing this so early, Pacific time. It's Lisa, it sounds like two questions. The SBC skills and the teaching is slightly different, although there are core competencies in teaching, and I'm sure Anton can add to that, since he's teaching now. But in terms of the SBC skills that are relevant, to outside global health and development for social change in the US, there's a long list: communication, behavioral science, community engagement, human-centered design, behavioral economics, marketing, partnerships with implementing agencies, community-based organizations, M&E, system strengthening, and of course, all of the other languages, especially languages that represent minority populations in the US. I'll just go quickly to the student part. In terms of the most important thing when I'm teaching social marketing, and I do always talk about SBC because it's a whole other world out there using most of the very same principles and processes with different names, but really the same. The biggest difference, students always ask, what is the difference between health communication and SBC or social marketing? That's the big question. When they come into my class, they believe that health promotion is the larger umbrella and that social marketing is a smaller piece under it. When they leave my class, they understand that social marketing, or SBC, is really the larger umbrella, with health communication or health promotion being a smaller spoke. And again, the most important is I explain that with social marketing and SBC, we understand the importance of the environment and behavior change. And what we do is design interventions aimed at making a desired behavior more achievable, easier to perform. And that goes beyond communication. It certainly goes beyond information and telling people what we want them to do. So I will turn that over to, I see Jennifer and Anton both nodding.
Oh, good.
Jennifer.
Terrific. And so much of what you said resonates with me and us also. So it's great to hear that the language we use cuts across, even although we might get more into that. Anton, as a current professor, is there anything you would add?
Just a bit,
Mhm.
and I also had the pleasure of guest lecturing for Linda. And if anybody is interested, I mean, Linda is just amazing. She has so much knowledge, information, and who was it that said inspiration? She's really very good.
I think
Um,
you're saying that I'm old, Anton. Thank you.
no, it's just that you've managed to cram so much experience into so little time. But well, first of all, it's great to be here. I'm really glad to see. I see a lot of friends and familiar names and faces. So it's great to be here. And I said to the organizers, I may have some expertise, mostly longevity. So I've got experience in different fields and whatnot. But I think we want to hear from you all too, because many of you have been out in a job market and have good experiences to share and lessons that you've probably learned over these past few months. So as for me, yeah, I've really enjoyed teaching. Um, and I don't know if you experienced this, Linda, but I really find dealing with students to be rewarding. So it's partly I want to impart stuff, but I also get a lot back. Just to get the pulse of where this current generation is. And one of the things that I heard from the students in my first class of the year was 2 days after I was terminated. So I asked the students, what is your take on all of this? And they're worried. They're worried. And I think, not just the elimination of USAID and funding, but things like artificial intelligence is really impacting what they see as their possible future prospects. And it really changed abruptly in January. But I try to you know to instill in them a few things that I found important over the years. And as Joel said, I started in commercial marketing, advertising research, actually. I call it communication research because advertising gets a bad rap with some people. Uh, but in the advertising research business, one of the first meetings I went to with one of our senior folks, and he was explaining what we did, and I've never forgotten what he said. He said, when the decision makers sit around the table and they're deciding what to do, and you've got the CEO and the COO and brand managers and whoever, he said, our job is to make sure that the voice of the consumer is at that table and taken into consideration. And wherever I've been, I some version of that is in my head. And so what I try to get across to students is the need to focus on the needs of the community. And in the public sector, we tend to say needs, maybe wants. In the commercial sector, it's more desires, right? You really need to go beyond what people need and provide them more of a frictionless experience. In the public sector, we stick more to the basics. But I want them to focus on the community. And the second thing I try to get across, and it's part of one of the courses I teach, is comprehensive planning, that you don't jump to an intervention, that you know the process. I want to make sure that new practitioners don't just say, "Oh, we have a problem with uptake of services, so let's get somebody like Linda involved and mount a wonderful creative campaign." Of course, Linda's great because she'll say that's not where we start, but don't jump to the intervention. So, what is that logical planning process? What are the consumer insights? How do you unravel a problem so that you really understand it and have evidence to provide you with insights. And one thing that I think is a little hard to get across, but I always look for in everything that I do and that the students come up with is their ability to tell a story. If they're writing a proposal from the beginning to the end, from the problem to the intervention to the solution to the numbers, don't include stuff that is not part of a narrative that you're creating. Um, and so that, and then yeah, I think I did enough talking. I'll sort of pause
Oh,
there.
yeah, very insightful. Thank you so much, Anton. Again, I can see all of us bring so much of that, but maybe it's about using slightly different terms. So thank you for highlighting that. Um, Jennifer, thank you again for joining us from the West Coast, as Linda said. And I know you're the program director of the Metropolitan Group, which does really fascinating work. We'd love to hear anything you want to share. And also, if you'd reflect on any other skills or knowledge that Linda or Anton may not have mentioned that you look for when you're hiring new staff.
Yeah, thanks, Lisa. Good morning, everybody. It's nice to be here with you. Metropolitan Group is a social impact communication and strategy firm. I'm in our Portland, Oregon office. We have a Washington, D.C. office and also a sister agency in Mexico City called Impacto Social Metropolitan Group. 100% yes to everything Linda and Anton just shared in terms of skills. And just an anecdote I'll share with all of you is I've done work in social marketing for years, decades. And over time, my work has really shifted more to a focus on system, policy, environment change, including a lot of work in narrative change. I work domestically. Other people in my company work globally. We did a lot of work for a long time with USAID, especially on democracy narratives. So I'm feeling where a lot of you are in terms of impact of everything that's happening. When our team first started working with USAID and they started talking about SBC, I was like, what are you talking about? Is this the thing that I'm supposed to know that I don't know? And as I dug into it, I was like, wait, isn't this what I've been doing for 30 years? It's what you do is what I do. It's just, as Linda said, it's social marketing, it's public policy shifts, it's environmental shifts, it's the same thing. So don't feel like you're stepping into a new environment of different skills. You bring incredible skills and the same skills into the work that we do. Metropolitan Group works in strategic communication, organizational strategy and innovation, and intercultural communication. That's what you do, right? Like, so strategic communication is about really deeply understanding the communities where you're working. It's about plain language communication. It's about really responsible transcreation and not sloppy AI-driven translation. It's about deeply, deeply meeting communities where they are with a spirit of humility and learning. And I know that that's what you bring into your work. And that's a trend that I see increasing actually in the US, especially in state public health departments, where people have had a commitment to working with a center of equity and a center of community. But what that has too often meant is going out and extracting information from community and then doing what public health is going to do anyway. And now I'm seeing much more of a focus on co-creation, agency, ownership of assets within community. And again, I think that's such a skill that you all bring to the work. That's something that I look for when I'm hiring people, is really understanding what that means. And so I see that in your field and in your work. Organizational strategy and innovation, that's what Anton said. That's about really deeply understanding an organization, the environment it lives in, its funding, it's all of its various audience groups, people who are concerned, people who are in opposition. What is the strategy of what you're trying to do and the organization where it sits? And then the other piece of our work is intercultural engagement. And again, you're all pros at that. And so that's about understanding differences and similarities between cultures. It's about really getting underneath both needs and strengths in communities where you're working. And again, it's about language, whether that's English and other languages, or the language of young people, or the language of people living with disabilities, or the language of people living under an oppressive government regime. And so again, I'm looking for, I think, what you bring. The other thing I was going to say is some of the trends that I'm seeing. I might be jumping ahead to a different question, but I'm thinking about this more and more when I'm hiring, because I want to think about people who are poised to go into the future. I want to hire people who are going to take our agency where we aren't already. And so again, that like really true community-driven decision making and working with humility in and with communities is huge for me. Community-informed transcreation and plain language. And if you read Dr. Sandro Galea from Washington University, St. Louis, he has an amazing blog called The Healthiest Goldfish. He talks about liberal and illiberal public health, not the political kind of liberal, but like liberal in being open to and listening to other points of view, rather than coming in and being dictatorial and dogmatic in the way that we work. And so again, I want people who can come in and understand the language of the people they need. A lot of the transcreation work we do is working with state agencies to say, I know you think you have to say these words because it's what your CDC grant says, or it's how you talk about it, but those words don't make any sense to the people you're talking to. And so like, how can we really deeply understand how to talk about and deliver services that make sense? And then I'm also looking for people who can really think deeply about a program design and evaluating that program. And again, doing that with the communities that are most affected and impacted, and designing with us the program. What matters to them? How are we going to know if this makes a difference? I'm going to put my email in the chat. Our agency is a place where we do the work that you do. There are other agencies like ours, Burness Communication, Rescue Social Change, Rally. There are a lot of firms like mine. Watch our website. The flip side of that is like we're hurting too. So all of our international work is gone, all of our federal work is gone, and there's a lot more competition for foundation and nonprofit and public sector work, but it's there. So I'm happy for you to send me your resume, watch our website. Like you are the kind of folks I want to hire when I can. So thanks for having me here.
Oh, Jennifer, thank you so much. I'm so glad Barbara has recorded this because I know I will go back and listen to everything you just said a few more times. It all resonated so deeply and so beautiful that you're doing that work already here. Um, so thank you so much. And I'm sorry that you're experiencing that. We are too. Um, Yeah, so this has been fantastic. And all of you have already answered our next question about terminology. So I think we can skip right over that and get into some reflection. And Jennifer, thanks for kicking off trends coming. So for all of our wonderful panelists, we'd love to ask, what, if anything, can we do as a community to change the future of how people think about, look at social marketing, social change, however we want to call it. So some repositioning or advocacy that we might start to think about now. So anyone who wants to go first is welcome.
I'll start while others are gathering their thoughts. I think what we're doing today is part of this process. And I've stayed in touch with many of my colleagues, and I want to call them colleagues rather than former colleagues because I feel like we're in this business for the long haul, no matter what. I've moved through. I counted up at least 10 different organizations that I've worked for, and I feel like um, I've worked towards the same goals and missions, in each of them. The context has been different, the problems have been different, but the through line has been, very consistent. And so I'm really happy that we're kind of sticking together because I think that's what we need to do. And there'll be another side to this. I don't know what it's going to look like. I don't have a crystal ball. Um, but I'm hoping that the majority of us will be working in whatever we call this, but that space where we, look at what people want, what they need, to improve people's, health and welfare, and work on these development issues. I think, I'll say one specific thing. When I started working on USAID projects, which was in the 90s, early 90s, one of the things that my first boss said was that, we're really doing this out of the convergence of a few technologies. One, there were product technologies such as oral contraceptives, even oral rehydration solutions, these life-saving breakthroughs that could save a lot of lives and do it very efficiently and effectively. And the other was, just the use of, mass media and media technologies. Um, and Linda talked about social marketing, and I still tend to use kind of a marketing mindset when I think of these things. And today, I think the technologies have changed. They've changed a lot. Um, but but I think this is an area that we, given the work that we've done, our community focus, I hope that we keep our eye on the ball because when I see the things that are emerging now, like artificial intelligence, robotics, gamification, predictive analytics. So much of this is sort of separate from um, humanity, right? And our job, I feel, is to make sure the ethics are there, the integrity is there, the human needs are being met, that AI is used for good, and that these technologies are brought to people. I mean, we don't have to worry about the upper class, right? I mean, they'll do fine. They'll have robots in their home serving them coffee. But what about the populations that we've always worried about? How can AI, for instance, um, provide people with those needs? So I think we should keep our eye on those kinds of things. Where's technology going? Where's the culture going? And how can we bring those technologies to the folks that we really care about? Um, Maybe that's I'll pause there. I think I saw Linda ready to go. So maybe Linda, over to you.
Thanks, Anton. Yeah, I think the two questions, Lisa, are really kind of combined.
Linda, you've muted.
Sorry about that. What I was saying, Lisa, is I think that the two questions, the way we speak about SBC and the future, what we can do to rewrite the future, are very much intertwined. Anton and I and Jennifer go back. I worked with Jennifer on the domestic side many, many years ago when neither one of us had gray hair. And I've worked with Anton, since the late 80s, early 90s. And the names, the acronyms have changed like crazy, like crazy. What we call the work that we do. Excuse me. Now I'm going to lose my voice. Sorry about that. I came also, like Anton, directly from the private sector, advertising world. And when I read about social marketing in an article in an old ad age, I was working in Hong Kong as a creative director for a big multinational ad agency. And I read about this wonderful work in family planning that was going on in Bangladesh and India, applying the same kind of skills that we were using in advertising to help people, to bring them what they needed, to create change. Anton and I first worked on a project called SOMARK. Actually, USAID called what we do, the SBC work, same work, social marketing. So much so that they even named a project after it. It was the SOMARK project. It was a huge multinational project. This is the benefit of longevity, Anton. We have seen, as has Jennifer, we have seen on the international side, we started with social marketing. What happened was at USAID, internationally, because we mostly marketed products in the beginning, it was the beginning of HIV. So we were marketing condoms. We were marketing ORS for child survival. We were marketing treated bed nets to prevent malaria. So because we started by focusing on quite a lot of product marketing, unfortunately, social marketing became misperceived as marketing subsidized products. And so that's when the acronyms, the names started changing. We went from social marketing, there was a little IEC in the beginning till we realized that information alone doesn't change behavior. Then we got to BCC, then we realized the environment was important. We got to SBC, and finally SBCC, and now we're back to SBC. So my point is that I believe as an SBC professional, when you are marketing yourself outside of the SBC world, use the very same knowledge and wisdom that you have when you're marketing or promoting anything else. Understand who your target audience is. Most likely they've never heard of SBC. So do not use the term SBC. Social and behavior change, maybe. But I think using terms like behavioral marketing or behavioral interventions, I think is going to get you a lot further. Just one example of that. The name of the first car. Does anybody know what the name of the first car was?
Car,
Yeah.
like CAR?
Like CAR.
Benz?
No. So the name of the very first car it was not called a car, it was called a horseless carriage. The reason for that is because people knew what carriages drawn by horses were. So the car was introduced as something, it always has to be based on what people already know. So I guess my advice would be when you're branding yourself, when you're repositioning yourself, use terminology. I mean, this is fairly obvious that the people you're talking to know. I would also say, just to save the future, let us all continue to promote, especially now, kindness, empathy, humanity, caring. We got a lot of counter marketing to do in with the current political environment. It's pretty nasty. I think our work's cut out for us. So I think we need to be the angel squad. Jennifer, I'll turn it over to you.
Hmm. I'm loving this and the great stuff happening in the chat. And I can't effectively multitask as well as I could back when I met Linda a million years ago. A few things I would add. Just to speak plain language. Like, forget the terminology. And like when I say to people, I work in a social impact strategy and communication firm, they like fall over of boredom. So I say things like, I work in public health. I want all people to have the best opportunity to reach the best health and well-being they can. And so what I do is I look for what's happening in a community that stands in the way of all people being healthy, and I figure out how to knock those things down. So, like, how do you explain this to your neighbor who doesn't speak all this jargon? How do you explain it to a sixth grader? I'm serious. Not, and then I'm not talking dumb it down. I'm talking like just speak language that people understand, right? When you talk to somebody who works in high tech and they say all this stuff to you that doesn't make any sense, that's not helpful. So just say what you do and say what you love. Like, why do you do this work? That's the most important thing. Um, so that's like the main thing I would say to you. Other things that I'm thinking about, and this may be apropos or not to where the conversation is right now, but I'll just offer it. These are the things that I'm thinking about when I try to figure out like how to keep my agency solvent, how to keep growing my career in this wacky world. Um, AI, like what is that going to mean? And the thing that I'm really focused on right now with AI is just a reflection of what has already existed. And what has already existed is like a lot of structural racism and mis and disinformation. And so, what are ways that I can understand and use AI that might shape the mechanism? I don't really want to work in high tech, but like, are there things that I can figure out about how AI algorithms work? I'm trying to watch for companies that want to set up new AI tools, new large language models that are focused on equity and true information. Like, where is that field going to grow? And is there a place for us to be there? I don't know the answer to that, but that's a question that I'm asking. I have to think about as a private agency looking for contracts, where is the money going to come from? Like who's doing this work and who's funding the work? And where do I find interest or curiosity or creativity in those spaces? So billionaires, unfortunately, are running the show right now, right? And so I don't like that. But how do I get to know the Mackenzie Scotts, the Melinda Gateses, the Bill Gateses who are doing domestic work as well as international work? Those are hard doors to break down. But where does that money flow? And where is the interest going to come from those places? I'm curious about private sector. There's a lot of concern right now in the US public health space about shifting from government funded public health to privatization and financialization of public health. And I'm worried about that too. But in the short term, if that's where public health work is going to happen, how do I understand that? And who's doing that work responsibly and in a way that's interesting? Like, I don't want to work for big pharma. But absent anybody else doing anything with vaccines, is that a place where I am interested? I don't know. So I'm trying to follow the money and figure out what that might look like and what are the expectations we can help to create for private sector and market-driven solutions, whether we support those in the long term or not. What's the reality right now and how do we make that the best it can be? And then the other thing I'm thinking a lot about in much of my work, as I know you all do too, is in the US, we're such an individualistic place. And so everything that is like the first instinct of most interventions is to fix the individual or to make it better for the individual in the short term versus thinking more collectively. So, like right now, I'm working on a project that's looking at how we think about wealth. What are the narratives about wealth in the United States? Who has it? Who should have it? How do you get it? Why is it important? What even is it? The project that I'm working on has the hypothesis that those narratives that are very much like everybody in it for yourself, pull yourself up by the bootstraps, get as much as you can, hoard it. Like you're in it for yourself because nobody else is in it for you. Those narratives about wealth are hugely harmful in trying to create a public health population centered mentality. And so I am really interested in how do we as a field, and maybe you can bring this, because a lot of the environments you've worked in, I would guess, are more collective than individualistic. And some of that is because of the history of how a country was formed, right? Different than the United States. But what have you seen about people coming together collectively to solve a problem, taking care of a population collectively versus individually? And is any of that transferable at a local community, state, or population level across the United States? That may be something really interesting that you all could bring.
Wow, I don't know if you could tell we were all agreeing and just getting so inspired as you're talking, Jennifer. That was amazing. In the interest of time, I'm going to hand it over to Barbara, who will go through some of the great questions and comments that have already come in the chat, and then any others that all of you might have, including experiences you're having in looking at how these skills can be transferred. Over to you, Barbara.
Great. Thanks. Thank you, Lisa. And thank you to all of our panelists. So just to mention in the chat, there were a lot of great resources shared. There's a conference going on in Spain. There's some places to look for, potential jobs. But as I said at the beginning, or as I put in the chat at the beginning, we first want to see if anyone in the audience has anything that they would like to add to the questions that the panelists answered. So I put them here on the screen, and I included Andrew's 2 questions. I summarized them a little bit, and I'll see if I can make this just a little bit bigger with full presentation mode. But I'd like to just take a few minutes to see if anyone has anything they would like to add. And feel free to just unmute and share. If it gets too crazy, we'll find another way. But
Hi, this is Gail. Can you hear me?
we can hear you, Gail.
Sorry, I'm in a car. I'm not driving though. I just wanted to add that when I came back to the States after being overseas for several years, I had all the same questions. Now, this was again back in the 90s. I was switching careers just because I had 2 little kids and I didn't want to travel anymore. And I had no idea how to make that switch back. But I got an interview with the biggest tobacco control project in the US at the time. And I was asked this question, how do you think, you can add value to our project, given that you haven't worked on tobacco, you've been out of the country, et cetera. And I just said, you know what? The first time I went to Morocco, I had never been there. I didn't know what the situation was, but I knew what questions to ask. And again, it was like more of a process that I knew was right that we had to follow, no matter what the context or country. And I was told afterwards that that answer is what got me the job. So I just wanted to share that. Thanks.
So I'll jump in here. Hi, everyone. My name is Dana Faulkner. I've had the great pleasure of serving as somewhat of a guest lecturer for some of the courses that Anton has been teaching. And I think I recognize some of the names, so I think we've probably crossed paths quite a bit over the years. I just want to add one thought, which is going to be very small bore compared to the kind of international work and countrywide work that most of you have been working in. But I started my experience in the healthcare industry with a large university teaching hospital. And some, not all of them, but many of those hospitals have very large budgets, as I'm sure you know, and large communication offices and activities. And as I interact myself for relatives and also on my own, I'm always appalled at the really poor quality of the communications that doctors' offices and hospitals and clinics and everything are offering to their patients. I mean, I always think I'm a reasonably well-educated native speaker of English. And if
I can't understand the prep instructions that they've written instructions that they've given me, then who else has a chance? So just again, this is a very small bore thought, but many of you through your work have such skills at communicating at different levels and with different populations that if you're looking for some kind of an interim assignment that can carry you through the job search that you're doing, it's possible that there are hospitals or hospital networks, particularly the big ones and the well-funded ones, have needs, could use the help of an outside person with a lot of communication skills with marginalized communities, and to offer some of those services or to just do informational interviews around what their needs are in those services could be a way of opening a door or expanding your network. So again, I offer that. I know it's very small bore, but your skills are really needed in those kind of contexts.
Thank you, Gail. Thank you, Dana. Is there any other perspectives or insights anyone like to share based off the discussion so far?
Barbara, Julia had a great point in the chat in response to one of Andrew's comments about terminology. Julia, I don't know if you want to come off mute.
I think, yes, am I live?
Yes, yes.
Thank you. I was just building on some of the, first of all, I have to stop and say it's so nice to quote see all the familiar names, and I've missed you all and many new folks, so this is a delight. I was drilling a little bit deeper onto the kind of search terms, and I know as I look, almost anything that I'll put in search terms that have behavioral, yield that more individual, if you will, behavioral health, which is really sort of one-on-one counseling, requires all kinds of certifications of counselors, and frankly isn't the focus of our field either. It's not what many of us want to be doing. So I was asking a little bit more broadly if folks wanted to chime in, and particularly our speakers, of the kinds of search terms, and we've touched on that some since I wrote the question. One, I'll offer to the group, I mean, just consumer insights seems to be more de jour now, so that's yielding some things that have to do with the qualitative mixed methods research that we'll do. So consumer insights, even facilitation is yielding things because it's getting more at issues of reaching people, from their point of view. So it was a more open-ended question for the speakers and others if they wanted to comment on experience of the kinds of search terms that are yielding more relevant activities. Thank you.
Does anyone have any thoughts about that as part of the job search, or we'll put it back to our esteemed panelists?
I mean, probably the most common would be health communication, even though I know what we all do goes far beyond that. That would be a very common search term, health comm, and then community engagement or community mobilization. I think you'd probably find quite a lot under those two silos. Yeah, so in addition to the healthcare industry, let's not forget insurance, although that's not the prettiest. And go back to the products. There's a huge, group of multinational corporations. It might feel like we're selling out, but I don't believe that. I think there are good people doing good work everywhere. So packaged good companies, companies that are making innovative products, water filtration products, still condoms, prep. So I think, Jennifer touched on that. I think definitely look into different multinational corporations where your global perspectives really offer so much value.
If I can just add, as I said, I've always felt my through line in all the jobs that I've had is this focus on the consumer, whether you call it community, client, um, you know, audience is a term that we had used at one point. Um, and for me, it's really what motivates me, what I really enjoy doing, getting consumer insights. And I think, when we think about skills that will match up with an industry, whatever that industry will be, we're more than tools in an employer's tool belt. When I think any employer is looking for someone who brings something to the party of themselves that is not, in the job description, that is not cookie cutter. You know, um, I think Gail was talking about, Bill Novelli hiring her. I'm not exactly sure, but Bill knows good people, and he recognized Gail as good people, no matter what words came out of her mouth or what terminology she said. But so for me, you know, I one of the terms that I've seen, bandied about is user experience, sometimes shortened as UX, and consumer insights, design thinking, behavioral. I don't think they call it behavioral design, but design in some fashion. So I would go for those kinds of terms because I think it'll get me to the kinds of companies that want to bring consumer insights to the table, which is what I want to do. And then if I was in that interview, I think I would be excited about the prospect, which I think is just as important as being able to say, I've done this and this and this and this, and you need this and this and this. I think you want to, bring yourself to the party and don't be afraid to show who you really are, um, even if it doesn't match up 100% with the job description.
Yeah, I totally agree with that. The other thing is the B Lab is the letter B lab is the organization for B Corps, so social impact private sector organizations. Looking through the list of who's certified as a B Corporation will give you a list of private sector organizations that have a focus on social impact. And so that's where you might find some of that design thinking, human-centered design, customer experience work that Anton is talking about. I was just looking at Beth, what you're saying about AI in the chat, and I feel the same. And also, I don't think I can stop AI. So, like, yeah, I don't trust it to be conscionable and objective in doing the work that I do. And are lots of people going to turn to it because they can't afford to hire me? Yeah. And so, how do I understand that? And I'm trying to not be freaked out by it. I'm trying to understand it, right? And figure out where I can mess with it or where I can use it in the best way. And I will say, I said this to Andrew earlier in the chat. If you haven't had a long conversation with GPT or Claude or with whatever model of your choices about this is the work I do. I call it this. What do job listings in the US call it? Tell me more about this job. How should I position myself? How does AI search for people who do what I do? Like, you need to go have that conversation with a large language model because it's going to tell you back all the words that you should be using because that's what is being used in AI. So if you haven't already done that, even though you don't trust it and it's horrible in many ways, go do that.
I had a question for the panelists or anyone else also who would like to answer. So, I've been working in community-based global health for many years and still continue to do so, but, it's always at risk of the organization going away, I guess. But I'm wondering if you could speak a bit about what public health looks like in the US. Like, I think what I'm hearing a lot from the conversation today is, this communication thing, but it seems like it's at a distance. And, we do have some like one-on-one counseling in hospitals and whatnot that's been brought up as well. But like the community-based global health I'm used to is like, feels like a much more intimate experience. It's a lot about, like trying to shift social norms through like key influencers and mother to mother training and like kind of reducing barriers in the household and but it seems to be more on like this group level or like the community as a unit or a small set of communities and I'm not really sure if that's even a thing that we do in the States. I don't know if you all could speak a bit to like what it looks like here. Is there community-based like health programs aside from maybe in the small NGO world?
I reached out to a friend and colleague who worked in one of the departments of health in, I believe it was New Mexico, and he wrote me back and he said it was kind of sobering. He said, if that's the direction that you're headed, he said, be ready for some changes. He said, he served as a chief of party. We were on the same project in Thailand for a while, so he happened to be the chief of party, so he was a big deal. He said, when you enter a Department of Health, you're no longer that foreign expert. And he said, and nobody wants to hear this is how we did it in Burma or Thailand. And if you say SBC, they will just glaze over. And he said nobody knows what a chief of party is. So he didn't. I don't think he said this exactly, but one takeaway I had was, you know, um, if we're shifting contexts and we're kind of moving into an area that we're less familiar with, humility is a really important quality. You know, we think about skills a lot, and then we have broader skills, right? Management, communication, oral and written, writing skills, all of those things that we know about. But then there's, I think at a higher level, there are those, values, ethics, and what we used to call character, and I think humility is just such an important quality. I think all of us, we do good on empathy. This is a crowd that is pretty good on empathy, which, um, I also value a lot. But I think what he was saying is when you enter a new field, um, uh, you know, don't think that you're the expert in the room. Learn the terminology. People around you. You mentioned community. They know their communities probably a lot better than you do. So that's not something that you're going to sit there and tell them what to do. I like Gail's comment about just understanding, how to do things. I mean, Gail managed. I think you were regional director in that part of the world, and I mean, Gail knew how to get things done. I would have, if I'd been Bill, I would have hired her in a minute too. Um, so he said, so anyway, he had some specific points. He said salaries are a bit lower. He said bureaucracy, if you think the bureaucracy at USAID was bad, bureaucracy at departments of health is pretty horrible too. And he said the M&E standards that were so rigorous at USAID are maybe a little different. So, and nobody uses the term SBC. He said health communication, health promotion, behavioral science, public health campaigns. Those were all familiar terms. Um, and so, just to repeat, I think be adaptable, be humble,
I would
but
just,
but be confident too. I think the skills in how to do things is something you should have an inner confidence about. I think all the skills that you have will be worthwhile, but be humble about them.
I would just go back. I know we don't have a lot of time, like 4 minutes, and I think Jennifer can answer Barbara's question better than I can. But I will say that in all of the domestic work that I've ever done, it works in a very similar fashion. The state health departments get grants from the federal agencies. It used to be a lot of CDC, NIH. That's changing, as you know. Public health at the moment is very volatile. We know who the secretary of HHS is and tends to be a volatile personality. So I think public health is kind of reflecting that. However, in my experience, all of the grants, the grantees in the state health departments, one of the mandates is to work with community-based organizations that are focused on specific issues. And so community is always involved. And I know Jennifer you guys do quite a lot of community-based work, so you might want to just add.
You know, the thing I was thinking about is I think more of that work always has and probably will continue to happen more at the county public health level. Funding is not great there, but that's where you see more like individual human-centered delivery of services. And then it also made me think about there's a program at the Crown Institute, which I just put in the chat, called ALMA, which is a really deep wraparound support program, peer-based, like promotora model delivery for moms. And so there may be things like that. Again, those places are going to have trouble with funding, but they're also the places where Melinda Gates and Mackenzie Scott are dumping funds. So look at programs like that are really looking at innovative service delivery and really community-based care. There may be opportunity there.
Wonderful. Thank you all. I know we just have 2 minutes left. Apologies to the rest of the audience for taking that last question slot. I thank you all so much, Anton, Linda, and Jennifer. It was like really nice to come together as a community around these issues and to hear your insights from working in domestic health. We have just a few announcements that Lisa put here in the chat. One, if you're not part of the SBC listserv or a core group and would like to be, there's a link you can just add yourself. If you have trouble with it, feel free to email one of us, Lisa, Joel, or myself. And then also we are planning on having our next webinar on September 25th, still figuring out the time. And Lisa put some details about that in the chat. Joel or Lisa, anything else we need to mention before we close today?
Well, just thank you so much to our panelists.
Yeah. And I just love our group so much. So we'll stay together. Thank you all.
Thank you all, everyone. I hope you have a great
Thank
rest.
you.
Thank you.
Bye.
Bye.